And then I'd like to introduce Sarah and Bethany. And everyone knows the topic today is about hiring a caregiver and what an overwhelming task it can be. So Bethany and Sarah are here to help us navigate through this complicated issue. Medicare.gov is an experienced licensed clinical social worker with a history of working in the hospital and healthcare industry for over 25 years. She holds her master's degree in social work and holds a master's in management as well as leadership. Sarah Livingston is a community gerontologist with a deep knowledge of resources in the St. Louis area and experience in engaging and supporting people who are navigating life challenges. She's got a master's degree in gerontology and psychology and is manager of St. Louis North for nearly 5 years. So I'm going to turn it over to Sarah, and you can take it away.
Great. Thank you so much, Laura. It's good to see many of you today. Looks like some familiar names and some new names and faces. So that's wonderful. Really happy to be here with you and with Bethany. She has a wealth of knowledge and experience. So what we're going to share with you today is intended to provide a basic overview of what to consider when choosing a caregiver. There are so many unique factors that can influence one's decision. So what we're talking about today are some things for you to think about and talk through with your loved ones, support system, and care partners. So before we move on, I do want to make sure that you all have this number. This is the number for ElderLink, which is JFS's older adult services department's information referral line. So since every situation is unique, it's often helpful to talk through the specifics with an unbiased professional. So ElderLink is the number to call, 314-812-9300. Calls are answered 8:30 to 5, Monday through Friday. So we're going to break today's talk into two main parts. First, we're going to talk about signs that help is needed and who to involve in conversations to determine what kind of assistance would be helpful. Second, we're going to talk about the types of home health services available, who provides those services, and potential sources of payment to cover the costs. Finally, we'll have an opportunity for your questions. So if you have questions during the presentation, we ask that you make a note to yourself or write it in the chat so we can address it after we've had a chance to go through the whole slide deck. We've tried to anticipate a lot of your questions, and so hopefully we've done that. But of course, we'd be delighted to answer your specific questions when we get to that Q&A part. All right, so let's jump right in. What are some signs that we might notice that we or someone we love needs help? So, oh, good. Okay, y'all see that mess, the clutter, the pots and pans. That might be a sign. We're also looking for things that don't look safe to us. Things that that really are a difference from how the person has always functioned. Medications, perhaps someone is confusing medications, having trouble keeping track of them, missing doses. Maybe there's a decline in personal hygiene. Maybe it's too difficult to get downstairs to the laundry area, so clothes aren't getting cleaned as frequently, or maybe some difficulties with balance and mobility might be getting in the way of someone feeling comfortable bathing alone. Another sign could be weight loss. Perhaps that is change in appetite that could be related to a health issue, a behavioral health issue, mood, or maybe it's just preparing the food. Preparing the food has become more difficult. So that's another thing to be on the lookout for. Another thing is confusion over noticing some confusion over tasks that previously were very familiar. So that could also be a sign that additional help is needed. So you've noticed that you or someone you love needs help. What's next? So ideally, let's not make assumptions. Let's keep an open mind, not make assumptions, and keep the person needing assistance and their desires in focus. In an ideal situation, you've had a chance to express your preferences for future plans, for future care. Oftentimes we make decisions in a crisis, but what we're trying to do now through this presentation is to really encourage people to think about it, plan, and have conversations about their preferences. And there are some wonderful free tools like this packet. This is from the Conversation Project. You can get this online. We are going to send a link to this conversation starter guide, as well as a whole bunch of other resources that we're talking about. We're going to send that. Laura's going to help us help make sure you get that after the presentation. So the conversation starter guide, it really gives step-by-step instructions on how to help people think through what matters most to them when it comes to making plans for the future and talking about preferences for end of life. This is something that is valuable for people of all ages. And we'd be happy to lead a whole separate session on having these types of conversations. Personally, I know my husband hates when I bring it up, but I want to bring it up almost every week just to make sure that, I know what he wants and he knows what I want. Some people feel strongly that they want to remain in their current living situation and are either open or willing to consider having people come into their home to help if it means they don't have to go anywhere. Others prefer the idea of moving somewhere where they're closer in proximity to others and perhaps have some meals and activities available. So that's why it's important to talk about it, because sometimes it's hard to imagine how someone could want something that we do not want, but that can be the case. And so it's good to ask questions and understand and do what we can to help realize their vision. And of course, what people want can change. So it's important to check in and reevaluate. So we talked about knowing the signs, knowing what matters to the person needing help. Next, it's a good idea to talk with, if it's you needing help, talk with your healthcare providers. If it's your loved one, ask if you can attend the appointment with them, or at least help write some questions down to address. See if there might be something going on, some underlying medical or medication issue that's contributing to some of these challenges. So we also know that, the situation in the world right now with us being isolated from COVID, that can really contribute to confusion and depression. And so really consulting with the healthcare providers is an important step. After you've spoken with the healthcare providers, it's important to talk with your support system. That looks different for everyone, but family, friends, and neighbors, they might be able to provide some insight into what they think might be helpful to the person, or to you, but they also might be able to provide some tangible assistance. So the next step is to create a list of care needs. Figure out what type of tasks might be helpful. What does the person who needs a little help, what do they need? What do they want? What will be helpful for the caregiver, for the person who's providing support? And so we have some examples of things that might be helpful. Perhaps companionship and conversation. Maybe some help with housekeeping, help with doing the laundry, cleaning the bathrooms, making the beds, putting the that gnarly fitted sheet on. That's tricky. Help with errands, transportation, maybe sorting through the bills and helping to pay those bills, sorting through the mail, appointment reminders or medication reminders. Either doing some home maintenance and repairs, actually doing it, or maybe supervising the type of work that needs to be done. Hygiene assistance is another area that someone might be able to help. Perhaps someone's unstable or maybe very fearful of falling. It might be nice to have someone who can walk with them. Another type of walking assistance could also be an actual device, whether it's a cane, a walker, a rollator, whatever the healthcare provider recommends for the individual based on what's going on with them specifically. Grocery shopping, meal planning, diet monitoring. And here are these question marks because only you and your loved ones know all the types of things that would be helpful. I know someone who loves, I fill her bird feeder every week because it's really important to her that she's been feeding the birds for over 40 years, and it's really important that they keep on coming to her. And so she, it doesn't make sense to have a home health person come and feed the birds. So getting a community volunteer works. So really, maybe it's feeding the dog, maybe it's walking the dog, changing the litter box. So really all the types of, that's why we encourage people to think about what's important to them, to talk with their healthcare provider, to talk with their support team, to make sure we get everything down on the list so that then when we have, we can start looking for solutions that can help people. So before we go to home care, that's going to be the last bullet on these potential sources of help. We are going to talk about some other options because home care can be expensive and most people pay out of pocket. And so most people come up with a combination of different strategies to make it work, to be able to afford what they need and to get some support otherwise. So are there pieces of equipment or gadgets that might be helpful to a person? What are their priorities for needing someone physically there? Because it can save a lot of money if you're able to rely on some of these, some other things. So when we're talking about adaptations, equipment and gadgets, what are we talking about? How about a medication dispensing unit that will have the pills packaged, based on the time of day, so that it's not, someone doesn't have to be sorting through the pills. Maybe it's an emergency response system. That's that button, I've fallen and I can't get up. That's that button. It can provide reassurance to someone, and it can also really help in emergency. Rollators, alarms on doors, night lights, cameras, robotic pets. Have you heard of that one? Those are they're very, very soothing actually. Grand pads, that's a technology. It's a tablet that is specifically designed for people with little familiarity with tablet devices. And so it's very simple to use and can really be a great way to connect with people, attend online programs, all sorts of things. Robotic vacuums are another thing that we're seeing people use. Another thing, bidets, a lot of these units that you put right on top of the commode, those have also, we're hearing from our friends in occupational therapy that can be very helpful for people and assists greatly with hygiene. Grab bars, of course, to reduce falling. Other things like Uber or Lyft to help with driving, with transportation, and food delivery. So those are a lot of things to consider. There are also home delivered and congregate meals. If someone's at least 60 years old, they're eligible for meals through the Area Agency on Aging. We're happy to talk with you more about that. We also provide the number for the Area Agency on Aging that is in our region. I alluded to this earlier, but exploring whether friends, family, and neighbors may be able to lend a hand. So we'll take one example, grocery shopping. If this is something that's really needed, does it make sense to have a family member or neighbor go with you or your loved one? Or does it make sense to order from Instacart? Or if that grocery trip is a really important part of your life and it may be worth paying someone, it may be worth paying someone from a home care agency to go with your loved one, make sure they're safe and get the socialization and have the opportunity to really look at the bananas and make sure it's the perfect banana for that person. Adult day services are another great option for some people. Their services are designed to provide social and some health services to adults who need supervised care in a safe place outside the home during the day. So, and drum roll, please, home care is what you all came here to talk about today. And so that's what we're going to talk about next. So I'm just going to share briefly the there are different categories of care based on what the person needs and the skill level of the person delivering the services. So some people and agencies offer all the types of care and some offer only certain kinds. Some types may be paid for by insurance and others are generally paid for privately or through community programs. So we're going to be talking about 4 different categories. The first category is companion services provided by a companion. And the cost of that is, of the options, the least expensive. And this includes, just like it sounds, companionship, visiting, recreational activities, having someone there with you or your loved one to provide some supervision, but be a friendly person who's there in case support is needed. Homemaker chore services. That includes light housekeeping, shopping, meal preparation. The provider is a home health aide. That person has gone through specific training, has had practice doing that kind of work and has been supervised. And so that comes at a higher cost. Personal care, that includes bathing, dressing, toileting, eating, exercising, help with those kinds of things. And again, that's done by a home health aide who has that training, who's been certified and licensed. And so that comes at that higher cost. And then finally, skilled care. So that requires a licensed health professional or nurse, could include wound care, physical therapy, occupational therapy, or other medical needs by a licensed health professional. Because that person has gone through a lot of school and is in high demand and performs these tasks that really take a high level of skill, that cost is the greatest. And so working with home health care agencies, they can help to coordinate. Maybe you need several different people to help and you want to make it as affordable as possible by getting the most service possible. And so many agencies have all of these people on staff and can help coordinate based on your individual needs. So this cartoon says, do my medical benefits cover being sick of rising medical costs? If only. So this leads to Bethany's part, and take it away, Bethany.
Thanks, Sarah. First, I just want to thank everyone for attending today and for your interest in the topic. I'm a strong advocate for education surrounding healthcare options, and hopefully you're attending today for planning purposes, which is the goal, so that when these situations do arise, perhaps you have some thoughts in your head about some avenues that you can explore before it's a crisis situation or something that you need to pull together very quickly. So I know the pressing question is, how will I afford having some help in the home if that's what you or your loved one's goal is to do? So we will very high level go over Medicare, Medicaid, Veterans Aid and Attendance Pension, Holocaust survivor benefits, long-term care insurance, what community resources that may be available here in St. Louis. And then of course, private pay, which Sarah said often is where people find themselves. But our goal is that you know all of the avenues to see if there's potentially any other payment sources before you get to the realization that you may have to pay out of pocket for this. So everyone's situation is unique. And the goal for today is that you walk away thinking, oh, my loved one was a veteran. Perhaps that's something I should do a little bit more exploring about and see if that's a program they may be eligible for. So we won't answer all of your questions, but we will save time at the end. There will also be links at the end and phone numbers. And like Sarah, I think mentioned at the beginning, you will receive all of those after the presentation too, so you can do a little more digging on your own. So we're first going to talk about Medicare. Most typically, Medicare is going to be ordered after a hospitalization, or if somebody has had a medical incident, a fall with some type of injury or something that they're at home recovering for. The two biggest things for Medicare to pay for this help at home is that it is through a physician order. So a doctor has to see that there is a skilled need for someone to be coming into the home, like a nurse, physical therapist, or occupational therapist or speech therapist. And then the person must be considered homebound. So in the eyes of Medicare, they will always want to pay for the least restrictive environment. So if somebody could go to, say, an outpatient therapy clinic following a knee surgery or a hip replacement, that's what they would prefer. So the person does need to not be able to get out on their own to be able to access the service anyplace else. The one thing about Medicare to know, it doesn't cover 24-hour care. It doesn't cover any of the homemaker services like we talked about, the meal prep and light housekeeping and things like that. It is possible to get some assistance with bathing if there is the skilled need, the nursing care, the physical therapy, or something along those lines. And it's time limited. Typically, home care patients receive home care services a few weeks, and then they would transition to some other sort of in-home assistance that would be through one of the other avenues that we'll talk about here. So next, we will talk about Medicaid. I know, at least in my household, in my family, I get asked many, many times, wait, Medicare or Medicaid? What's the difference? So I know sometimes those terms get tossed around and we don't always know quite what the difference is. So just briefly, Medicare is a federally funded program, 65 plus, right? Retirement. We're going to sign up for Medicare if we've worked and have paid into that system. It's not based on need. Anyone eligible can sign up for it. Medicaid is funded through the federal government and state funding, and it has very strict income and asset limits. So they sound very similar by name, but very different in terms of the needs that they're meeting. So through Medicaid, one could be eligible for home community-based services. So the first step in order to receive these in-home services through Medicaid is that you have to be eligible for Medicaid. So at the end, in the resource list, there will be a link to get you to where you can look at those Medicaid asset and income criteria to see if perhaps yourself or your loved one, whoever brings you here today, is perhaps eligible for Medicaid. That would be step one. If they are in fact eligible for Medicaid, really there will be quite an array of possible in-home assistance, from the companionship, personal care, to nursing care for medication setup and things like that. So once Medicaid is approved, the next step would be making the referral for the home community-based services program. And then someone will do an evaluation. They will come out. How many hours you receive is based on need. If someone just needs a little bit of help, they'll get a few hours. If someone is requiring quite a bit more of assistance, then they will probably receive more hours. So it really is all based on that assessment. But the goal of this program is to help people age in place at home and not go to a nursing home if that's not what their desire is. So that really is the intent of this program, and worth exploring if you think Medicaid might be an option. Oh, I did forget to say one thing. Often people ask me, they'll say, well, my neighbor's daughter gets paid to go over and take care of her. So if you've ever heard anybody say that, they are most likely receiving Medicaid, and the home community-based services can be provided by an agency that Medicaid will help get you connected with. Or if you have a loved one that is taking time from work or whatever the case may be and providing services, they can go through a training course at one of the approved agencies, and they can actually get paid to be your caregiver. So it's kind of a unique little niche, but often people will say that their family gets paid to take care of, and that's usually the case of how they're getting reimbursed. So I just wanted to point that out. Next is Veterans Aid and Attendance Program. So very specific benefit. There's very specific criteria, including income and asset criteria. And if someone's eligible for aid and attendance, what this would be is additional pension fund. So it would be additional money that could be received to help pay for help in the home. For veterans, they can also get funds for nursing home care. But again, for the population that wants to remain at home, the aid and attendance pension would be something to explore. Now, I even in my line of work, the Veterans Administration is a little challenging even for me to navigate, depending on what answers I'm trying to find. So what I always recommend is that you seek out the pension officer in your area, and we have a link to that at the end of the presentation. They really are a great first point of contact if you just don't know about what veterans benefits you or your loved one would be eligible for, and they can help you navigate that. So for this program, there's the list there of some of the specific criteria: 90 days active duty during a wartime period. Sometimes that's the first question I would ask someone and they'd say, nope, that doesn't apply. So these are a list of some of the things that do have to be in place. And then if you get yeses to all of these, then certainly it would be worth exploring further. So next we will talk about Holocaust survivor benefits. We are very fortunate to have our case manager, Robin, here at JFS. She helps get Holocaust survivors connected with benefits through claims conference. And there is quite a bit of assistance with the whole array of services, from the homemaking services to bathing to medication. They can do some more skilled type of care. And Robin is really the best person just to call if your loved one is a Holocaust survivor. She'd be happy to walk through that, the criteria for that. And then she actually does help with those applications, gets those sent into claims conference, and really just does a phenomenal job getting people connected. So we're very fortunate to have her here to help our clients get connected to those. So long-term care insurance, good just to think about this kind of like homeowners or auto insurance. I think a lot of people take these plans out. They may take, that sounds like a great idea and I'm not going to need that forever. Kind of like when we do our wills, like I'm just going to do it and then forget about it. So it's a good thing to remember to ask if this is for a loved one. And even if it's a loved one, maybe like an aunt or someone that you might not know all of their typical business day to day, but ask if they've ever taken out a long-term care insurance policy. Like I said, I feel like people can take these out. They kind of put them by the wayside, keep it there for the rainy day. The policy is as good as what they took out. So they may be eligible for a certain amount of hours, or there may be a cap on the amount of funds that they can have for the in-home assistance. Some of them also can pay for assisted living and can be utilized that way. So just a good thing to remember to ask about if somebody has that, and then call the policy and see what the coverage would be. So we are fortunate in St. Louis to have several agencies that do provide some assistance for in-home care. We are putting the phone numbers here, and those will be at the end of the presentation also. The best source probably is to just call the agency. Certainly you can look on their websites, but if you want to know if they have funding still available, depending on the time of year, and if they have space for the programs, it's probably best just to give them a call. So the first one we'll go over is Aging Ahead, and they have a few different programs. So Sarah nicely outlined sort of pulling all your resources together, especially if you're paying for out-of-pocket. And the Friendly Caller program is really just that. There's trained volunteers that will call and check in on your loved one at a scheduled time every week. So for someone that's doing okay on their own, sometimes doing a friendly call program, in addition to Meals on Wheels, where there's somebody else scheduled coming to drop things off, someone that's going to notice if something's not right, or if they don't answer the phone or answer the door. So it's kind of a nice addition for somebody that might be in that situation. The family caregiver support, they can provide a few hours of respite care a week. So if someone's taking care of their loved one in their home, this can be a really great option to provide a few hours for that person to have a little bit of respite time to take care of some other things that maybe they need to take care of. They can help with some incontinence supplies, nutritional supplements, home modifications like grab bars and things like that. So it can be a lot of support to someone who's taking care of their loved one and just needs a little extra support and care for themselves while they're doing so. The 50-hour program is specifically for patients who have had a hospitalization. So what's really nice about this is it's going to provide up to 50 hours, just like the name says, for anyone who's had the hospitalization, and they can utilize that within a 3-month period. Because often someone might be doing quite well on their own, but there's just something that happens, right? Something happened, they had a fall, they had a hospitalization, they need help just kind of getting back to where they were before. So this can be a great program just for that temporary amount of time to be able to help get them back to where they were. Visiting Respite Senior Companion. If you call Aging Ahead, they will get you connected to LifeWise. That's who they collaborate with to carry out the companion. And it's, again, trained senior volunteers that can connect with your loved one and have visits and just give them some additional support and socialization. So next we'll talk about Jewish Family Services. Again, Robin is here to help get people connected to the Holocaust survivor benefits. Our subsidized homemaker services, those also are income and asset. There's criteria around income and assets for the eligibility. The best thing to do is to call Alex at, she's who answers our ElderLink line at the phone number there. And then what we will try to do though is to first see, is our caller eligible for veterans, Medicaid, any of these other types of services? So our program really, the goal is to capture people, they're not eligible for Medicaid, so they can't get that assistance. If someone calls us, they're eligible for Medicaid, they're calling for homemaker, we're going to want to try to get them connected with Medicaid because they'll get a lot more services and probably hours if we get them connected with any of these other programs. But we will offer the homemaker services at a subsidized rate if they're eligible for that. Next one would be Lutheran Good Neighbor Program. They pay up to $10 an hour for in-home assistance. So if you have your own person set up, your agency, they'll give $10 to help offset that overall cost for you. And then St. Andrews Senior Solutions will offer up to 8 hours of in-home assistance a week. They also have income and asset criteria for their eligibility. So best just to call them and see. But what we find, at least for a lot of our clients, is 8 hours is actually quite a bit. If someone can go and do meal prep and do some light housekeeping, it really is just enough to help someone, continue to manage at home. So those are the local resources that we have. So when it comes to choosing, just want to kind of go over sort of steps, a process for you to think about. You'll want to, like Sarah outlined earlier in the presentation, what is the list of things that we need? My loved one, what's going to help them maintain safely at home? You can ask friends, neighbors, people that have utilized services before. Some people have had very great experience with a certain agency and they're a friend of yours. That absolutely is a valid way to kind of get an idea of what the services are that agency provides. I always recommend interviewing 2 or 3. Agencies should come out, they should help develop a care plan with your client, with your loved one, and be able to help assign the appropriate skill level of caregiver that you need. So they should take that time to get to know you all and be sure that they're able to meet the needs that you have. And then we'll show you just a few, 2 options of where you can find these. Where do I find the agencies and how do I know if they're good, right? Those are always the pressing questions. So a couple tools for that. The first one would be Medicare Compare. So if you go to Medicare.gov, They have a nice actually compare tool for many different services, dialysis, nursing homes, hospice. For our purposes today, we're looking at the home health care services. So any agency that provides Medicare reimbursed services, many of them also provide private pay. So they will be on this website and they will have a star rating. So you can enter your zip code, look at what agencies might be in your area, and look at the different rating scale for some of the things that Medicare looks at agencies for. I always tell people take it with a grain of salt. It can be difficult to have a 5-star rating. There can be very minor things that might drop the rating temporarily. It is quite fluid depending on anything that's been going on with the agencies or inspections and things like that. So definitely I would, again, talk with them in person. And then the next one would be the Community Resource Finder, which is a collaboration between Alzheimer's and Alzheimer's Association and AARP. So they have a lot of great options if you go here for other community resources, housing and things like that. For today, we'll look at the Care at Home tab. And in here, they're going to have home care, which would be all of your agencies, and home health care would be the ones that do the skilled care. So you may want to run a search on both. Again, you can do it by using the zip code to narrow that search down to where you live. And you'll just enter that in, and then it's going to pull this list up for you. And what I really like about their site is you can go through, you can save them, you can export it, and you'll get a very nice printed off PDF that will have all your information there. So as you're getting ready to plan your meetings with your agencies, you'll have everything right there printed out for you. And then to draw your attention, the little bubble up there is for recommended tips. And if you click on that, it will take you to a list of a few different good resources. But tips for choosing an in-home care provider is really a helpful tool that you may want to print off just to kind of get your thoughts around what are the questions that are important for you to know about who you might want to hire. And then with that, let's see here. What we hear often too is that I could probably find someone, there's so-and-so in the neighborhood and they took care of so-and-so's mom and they weren't nearly as expensive as one of those agencies. So we hear that a lot and completely understand that there can certainly be a cost savings to that. And my goal here today is not to advocate one or the other, but just to give you some food for thought on how you might make that decision for yourself. So some of the pros of the agency are going to be that they do background checks. They have liability insurance for their workers. They can provide backup care. If the caregiver is sick one day, what are you going to do? They can fill that most likely and send somebody else to temporarily fill in. The cons are they tend to be more expensive, and you might have a few different people coming in to provide care depending on the scheduling that you need. So hiring someone privately, you will save some money. You will have that same person, right? Because they're just working as an individual to provide that care. The cons though, and things to consider, which I think are probably the big ones where people find themselves thinking about, is the liability, because it's just hiring someone as a private arrangement, and that there's no backup. If they want to go to Florida with their family for vacation, then it's back to you to kind of figure out, how do I fill that gap? Where the agency will do a lot of that legwork, all of that legwork, to make sure that they're getting your needs met. So just some things to think about. So with that, this is the list of resources that you will, Laura with Mirowitz will get sent out to everyone at the end of the presentation here today. And of course, I wanted to put JFS Elder link at the top. That's Robin's number for the Holocaust survivors. And so you're free to give us a call for any follow-up questions or any additional needs down the road. So with that, we wanted to open it up. I saw Steve had a hand up a few moments ago. So appreciate your patience, and Sarah and I'd be happy to answer any questions now. or try. We'll try our best.
Well, while other people are thinking, when I stuck my hand up, you were on into equipment to consider. And I wondered if you'd had any experience with these elevators that people want to install on your steps, how they work, whether they're any good, whether they're dangerous, what you're thinking about them.
I can jump in on that. I would say I understand why they're very popular. Anyone that's at a high fall risk, certainly it can be life-changing to be able to help people get to their bedroom. I've worked with patients in the past that their bedroom and bathroom is on the top floor. They don't have one down on their main level. So for things like that, I do understand the practicality. I would always advise talk to your physician, talk to the doctor's office if they have any recommendations. Things to consider with anything like that is the cognitive ability of your loved one, in understanding how to use it. Can they use it safely? Things like that. But I know they can really make a big difference for people, you know, just staying at home, right? When it's just really the stairs are the big issue. Did that help, Steve?
Yeah, thank you.
You bet. Kevin? Do you have a
Yes,
question?
can you suggest strategies for elders who may not see their needs as clearly as those around them? Do I need to explain that, or?
No, I understand the question very, very well, I think, and I think it is definitely a very complicated situation that I've worked with many children of my generation with their older adult parents, and it definitely can be very complicated. Someone has the right to their own self-determination until they are deemed unfit to do so. So it can take a lot of conversations. There are, Sarah, you may need to help me because I might have brain freeze. There's a few agencies that can offer some assistance. Is it, Kevin, is it more cognitive decline that you're seeing specifically, or physical decline and just not wanting to go someplace else?
Well, I don't know if I don't know if I feel comfortable like doing.
Oh, that's okay.
But I think there's always, I think this balancing of respecting people's autonomy,
Yeah,
particularly for a generation that was very self-sufficient,
right.
and the particularly the post-war generation, I think, maybe it's just their experiences, but I think whenever you see both a combination of cognitive decline and physical decline, and trying to, say, let's do some pre-planning so we don't have to wait for a crisis to make a decision. I think that's been very hard, at least in my experience. So I want to be respectful of people's abilities to make their own decisions. On the other hand, there are times when, I would need other strategies to sort of get them to sort of see what the concern is.
So if they're open, their memory care home solutions is the agency I was trying to think of. They can come out and do some assessment. They work with occupational therapy. Their goal is really to help develop some strategies to help if you are working with a loved one who has some cognitive or dementia components that you're trying to work through. So sometimes I think for families, it can be helpful to pull in other resources. The doctor, do they like their doctor? Will they listen to their doctor? If there's some conversation about needing some more help, or their nutrition isn't doing very well, or they've lost weight, like Sarah had touched on, and getting Meals on Wheels or other resources. So sometimes pulling in a third party can be more effective than talking with family, although family needs to be involved in that, of course. I don't know if that was helpful, Kevin. It's a tough situation, I do acknowledge.
Is there any other questions?
Well, I can always ask them. Talk to us about hospice. When you talk to hospice, I had a friend who got them to deal with him and send people out a couple times a week for at least 2 years, maybe longer. And I always had the impression that you had to be about to die. And my impression now, as I watched that process, is most people wait way too long before they call them.
I agree.
At what point can hospice be helpful?
Do you want me to jump in, or Sarah, do you? Okay, so I know definitely talk to the doctor. One, it does take a physician order. There is specific criteria. Medicare is what covers hospice services. I have seen people be on hospice as well for quite some time, and then some people discharge from hospice. You know, it's definitely not an exact science. There's also palliative care that comes into play beforehand, which when someone is starting to feel things that I listen for is someone not wanting to go to the hospital anymore. I'm just so tired. Every time this flares up, I have to go to the hospital. It's very exhausting to go to the hospital. So those are things to pay attention to if the person in your life is going to the hospital and just starting to feel frustrated and exhausted and just not wanting to do those things. Palliative care is really all about choice, working with a palliative care physician to make decisions about, I want treatment for this. Yes, like those things make sense, but I'm not interested in this. Like really having control over how they want to manage their healthcare, which the Conversation Project, which Sarah had put up there earlier, is a really helpful tool to kind of talk through that. So hospice can be great. It can be provided in the home. It can be provided in a nursing facility. If it's provided in a nursing facility, patients and families pay out of pocket for the nursing home day-to-day rate, but Medicare covers the home care services. So I can't speak to the particular situation, why so long, but there is specific criteria, medical criteria that a client has to meet to be on hospice services.
But you can call them and they'll tell you if they think it's too soon.
Absolutely. I would encourage, again, talk with your doctor. And if it's maybe not quite at the end of lifetime, palliative care can be a really helpful bridge and also empowering to the patient to be able to make some decisions for themselves about really what they want.
I'm old enough that in my experience, some of the doctors were too old for this. And so when you raise the issue, they think it implies failure because they're in the business of curing people, but you don't cure people from dying. And so, you know,
exactly.
You have to know that. I have one last question on my list. You all talked about hiring an aide that had been trained. Could you talk to us a little bit about, I mean, what happens if somebody tells you, this person really took care of my husband and they were really, really good with him, but it turns out when you interview them, they haven't had any training. If you wanted to send them to be trained, would that make any difference? And how would you, I mean, maybe you offered to pay them to go do it. What could you talk a little bit about who does it and what kind of training they get and whether that makes any sense?
Do you want to take it, Bethany, or do you want?
You could go. Or I'm happy to go, but I didn't want to.
Go for it.
So
Come on, Sarah, you raised the issue. You ought to deal with it.
So are you talking about hiring someone privately that doesn't work for an agency?
Right. But you know, let's say your friend down the street said, no, this person was really great working with my husband or something like that.
Well, I know, you know, in different fields, people can take their own liability insurance out in terms of just the liability piece of it. So I don't know specifics about that.
What kind of liability are you thinking about?
Well, if someone would get injured on the job.
I see.
Personal care is quite physical. So for agencies, they cover that person, right? Where if it's a private arrangement, then it's that piece.
In other words, they're trying to help somebody in and out of the bathtub and their back goes out or something.
Yeah.
Okay.
So just something to be aware of. In terms of the certifications, you can be a certified nurse's aide, a home health aide. Anyone with those credentials can, help with personal care. I know certified nurse's aides can like take vital signs, like, some things. And there's programs that people can go to. I would suggest honestly talking at least to an agency about what criteria their caregivers have, and then kind of go from there.
Well,
But
if you were interviewing somebody, for instance, who had worked as an aide in a nursing home for years, would they learn anything if they got certified?
they probably were certified to be in the nursing home, at least if they were a certified nurse's aide. They do
Okay.
have educational.
Well, that's right. They have to
things
be
that
a
they need to
CNA to
do.
pass the med. So yeah, that's probably right.
Yeah, or a certified med tech. Those do all take certifications and exams, and then ongoing education to do that work in the nursing home.
And that's enough from what you're talking about.
For personal care, I mean, that's what CNAs do.
Okay, thanks.
Not nursing, not like wound care or anything too intensive. Anybody else?
Any other questions?
Thank you.
Stephanie
You're
and Sarah,
welcome.
thank you very much. You've done a wonderful job. This is a difficult topic, and I know everybody appreciates your time and your insight.
Yeah, thanks so much for having us, and I appreciate you all attending.
Thank you very much.
All right. Bye.
Bye-bye.